Welcome all. I have yelled at my family to be quiet, so hopefully, fingers crossed, everybody's good. I know people feel the same way as I do, probably. I'm nervous about who's going to come down the stairs. But really happy to connect again. Welcome to July. As a reminder, please use the video if you can. If you don't feel comfortable, that's okay, but video if you can. Mute if you're not speaking. Remember to unmute if you have a question, and we want this to be interactive, so feel free to do so. Introduce yourself in the chat, and then use the chat to kind of offer questions or ideas, links to things. We want that to be useful for you all. So welcome. Stanka, next slide for me. So I am Jody Dvorkin. I know a lot of you've been coming on for quite some time, so appreciate that. And Tani, my colleague, is out for a few weeks, taking some time for herself and her family. So I have my other little pea in the pod, Stanka Hadzik, who we work a lot together. So Stanka has been on these calls as well, and she's joining me to kind of co-host today. So you want to say hi to everyone, Stanka?
Hello, everybody. Stanka here. I'll be helping out Jody with the chat. So feel free to post any questions in the chat, or we will also be having opportunities to ask questions on the call as well.
Next slide, Stanka. So welcome everybody to July. It's July 1st. I think that this is how a lot of us and our workers and our organizations feel, a little bit of uncertainty and trepidation of what each month will bring. So just a reminder and a little bit of humor to inject, and yet recognizing that that uncertainty can be scary and that this is how a lot of us are feeling. So we're really excited today. We have two very special people who I talked to about a month ago, and I kind of got them booked because I wanted you to hear about what Kerry and Callie are doing over at Children's Minnesota, talking about resiliency rooms, peer support, and what they're really doing to help staff during COVID. So I'm really excited for their presentations, and I'm going to turn it over to them in a second. But before I do so, just want to go through what we have coming up for the next kind of 2 months. So we are really excited in 2 weeks, but it's on Tuesday, not Wednesday. So I put it in red and we'll send you a reminder. Dr. Albert Wu from Johns Hopkins, and he's the director of the Center for Health Services and Outcome Research. He's going to come and talk about their RISE peer support program. And Dr. Wu has actually coined the term second victim years ago to talk about how healthcare providers can be victims in the healthcare setting when medical errors occur, when bad things happen. And so most of his work is really focused on the well-being of healthcare staff. And so we're really excited to have him come and talk to us. Then back to our Wednesday schedule after that. On Wednesday, the July 29th, we have Dr. Darabai from Mayo, and she leads the Physician Wellbeing Program. They're doing a lot of great work. You've heard a little bit about some of Mayo's work throughout this series. But we are excited to have her come and talk more about some of the other things they're doing. August 12th on Wednesday is a TBD, and we'll let you know. We have some things in the hopper. And then on Wednesday, August 26th, we have Dr. Susan Scott, who works at University of Missouri. And she helped found the For You team, which has really been a team focused on helping their clinicians through medical errors, through workplace violence, through death of a colleague, and now through COVID. So they've had a evolution over the course of many years, and now they're doing work with this team around COVID. So really excited about what she has to say. And then Wednesday, September 9th, we have Dr. Jonathan Ripp, who is a Chief Wellness Officer at the bottom of the slide at Mount Sinai in New York. And so really wanted to get perspective of people who had been in the hot spot, what they were doing for their workers. I heard him talk in IHI talk last week, asked him to come speak to our group, and he was really happy to do so. So exciting. I think we have some diversity in geography, so maybe some different experiences across the country of what they've needed to do to adjust. So stay tuned, sign up, and we're excited. And if you have other ideas of people that you've seen in webinars or you've heard about that you think would benefit the group, let me know. People have been super receptive and kind in offering their time to come speak to our group. So I'm happy to reach out if you have any ideas. We just want to really bring good work to you all. Okay, any questions? All right, well, with that, I am going to turn it on to the main show. I'm just a supporting character here. Sanka, if you want to unshare, and I'll go ahead and share my screen. Oh. And Callie, I'm going to go ahead and turn it over to you so you can talk about the resiliency rooms.
Excellent. Thank you. Can everyone hear me okay?
Yes.
Hearing some not. Okay, great. Great. Well, I'll have you go to the next slide here and I'll introduce myself to the group. So my name is Qutechat. I have my bachelor's degree in psychology from South Dakota State and my master's degree in holistic health studies from St. Kate's here in the Twin Cities. And I have been a health and well-being program manager for the past 2 years now, working in the health promotions department over at HealthPartners in Bloomington. And in my position, I am contracted out with Children's Minnesota. And through the program that I manage there, it's called the Be Well program, we are really cultivating a culture of health and well-being throughout the children's organization. And so a main focus of that being that Children's is a large pediatric healthcare system, is focusing on mental and emotional health and well-being. So you can go to the next slide here. So one of the initiatives that we have brought over to Children's is called Resiliency Rooms. And a resiliency room is really a private, quiet space where employees can have that space and time for dedicating themselves to their own well-being by just taking a breather in the room or maybe going through a meditation. It really just provides that space for them to relax and unwind, to just take a breather, maybe on a long shift or at the end of the day or even before the day starts. And these rooms really help to replenish their energy, fuel some productivity, really improves their decision makings and reduces stress, and so that they can really be bringing them their best selves into the workplace, caring for sick children. Next slide, please. So the environment of a Serenity room really focuses on the 5 senses, or 4 out of the 5 senses, I should say. We typically don't include taste in there, as no food is usually allowed in the rooms. We want to keep the crumbs out of there, but we do focus on the aesthetic of the room, such as, maybe having some soft lighting in the room, maybe some images or pictures of nature, or some aspirational quotes or inspiration quotes on the wall is typically something that they would include. And then also kind of that feeling of being welcomed and invited when they walk into the resiliency room. So maybe having some soft couches or chairs or cushions or pillows or blankets is always nice. And then also having, something that they can hear that's peaceful, such as maybe a sound machine, or even having a rug on the floor if the room is maybe a little echoey. And then we also include smell with essential oils and aromatherapy. And so with that, though, we do want to be careful to not include candles or incense in the room, just because they are not only a fire hazard, but also some people might be a little more sensitive to different smells. And so we want to make sure that we're being careful of that. But that's kind of what the environment looks like in a Serenity room. So you can go ahead and move to the next slide. And so I'm kind of toying here with resiliency room, Serenity room. There's many different terms that you can call the rooms. Over at Children's, we coin them as resiliency rooms. And really each room is set up to benefit the employees that are in that certain unit or department. And so while it's nice to put together a kit of different options that they can choose from, such as what is shown here, all the rooms are not going to be the same. It's not all a same cookie cutter room. Everyone can kind of determine, what is best for their room and for their employee population in their unit or department. And so it's best practice to have a list of different options to include in the room, but not necessarily everyone is going to be using that. It just kind of offers, though, some choices to determine, what the budget might look like for a room like this, whether they want to put a massage chair or a recliner in the room, or where those items are going to be coming from. And then also kind of gives some thought as to, maybe you could have employees donate some of these items if they have things laying around their house, like an old yoga mat or a stretching band and such. And next slide, please. So these are a few images of 2 different Serenity rooms that we have over at Children's Minnesota. So the first one here on the left, the purple room, as you can see, they've painted the wall a really nice calming purple color. They've included some soft lighting so that those fluorescent lights that are on in the picture don't have to be necessarily on when you're sitting in the room. They've also included a massage machine on one of the chairs, and they have a salt lamp. They have a little succulent down there on the table, and they've really included a lot in their room to really make it their own. And I think that's really the beauty of these rooms, is that you can really make it your own and include things that are going to be the most beneficial for your team. In the second picture on the other side, there's some yoga mats in this room. They've also included just a nice neutral color on the wall. They've also put in some soft lighting, and also in the dresser drawers that someone donated, they also have some essential oils for aromatherapy. They have some gratitude journals from our Be Well program, as well as other flyers and promotional materials from the Be Well program as well. So as you can see, these rooms have really developed into whatever the needs are of the employee population. You can go to the next slide, please. And so you might be wondering, what are some of the best practices for putting together a room like this and kind of getting something started in your own locations. And so it's typically best to secure a space first. And so finding a space, whether that is maybe a closet that hasn't been utilized. There's many over at Children's that were converted from just an old supply closet, where they kind of took out the shelves and painted the walls and kind of got it put together just from a small little space. Some also might be from an old office area that isn't being utilized. So really take a look at what spaces you have available, and you can get kind of creative with it, because oftentimes there's only one person utilizing the room at a time. And so it doesn't have to be very big. Another best practice is once you kind of get that space secured, you're going to want to identify someone who is a point of contact, whether that's in a department or a unit at the hospital, to really communicate the benefits of utilizing the room, and really talk with them about how the room is going to be utilized, and how to get their leadership on board with getting the room developed and started. You might also want to include some of the unique resources that will be included in the room for their specific population. So that's where you really want to know your audience well when you're talking about the rooms. And then also to make sure that you have a plan for maintaining that space over time. So that point of contact really should be someone who is going to be taking on the responsibility to make sure the room is cared for and cleaned and such. And then also, you might want to check into which type of space you're using. So is it something where it's going to be a highly trafficked area? If so, is there a code to the door? Is there a badge entry needed? Do you have to reserve the room at all? So just a few things to take into consideration. Next slide, please. Some additional best practices to follow is, if you have items in the room that need to be wiped down, make sure that you are providing some disinfecting wipes. So if you have a stress ball in there that everybody is touching, you might want to include some wipes in there. Same with, the massage chairs, as well as yoga mats or foam rollers. Anything really that people are going to be touching, you'll want to make sure that you have some type of cleaning supply available in the room. And as I mentioned before, we typically leave food out of the room. So it's not really a place where employees are going to go and eat their lunch. It's really more of a space where they can go in there for, 5 to 10 minutes and maybe listen to a meditation. So if they want to bring their phone in, they certainly can. But we do want to also be mindful of the noise in the room. So we don't want it to be too noisy. We typically are trying to make it a little more quiet and private of a space. So typically we would limit like phone calls and that type of thing in the resiliency rooms. Also, you'll want to make sure that you keep a running inventory of different flyers or brochures that you're putting out in the room, as well as anything else that employees can take away from that. And so, just kind of make sure that you're keeping contact with that person in the unit that you're working with to determine if you need to replenish those at any time. And also I had mentioned before too, but just be conscious of fragrances, as some people are a little more sensitive to smells. That will probably be something that is determined by your point of contact person in the department or unit. And then, overall, just kind of keeping that room clean and neat is going to be really important to continue the use of the room. So we don't want the rooms to kind of just sit there and get messy and dirty, or have people spilling in there and such. So we want to make sure that someone is taking responsibility for that. And then I also had mentioned if the budgets are lower for putting different items into the room, you can certainly look into saving on some costs by asking for donations. So a lot of people are really willing, if they have an old couch or an old chair in their basement or something they want to get rid of, they're often willing to donate that to the room. And oftentimes that's a good route to go if you don't have a really big budget to be working with. Next slide, please. So I want to go over also a few more ways that you can work on gaining buy-in to be able to develop one of these rooms. It's usually best that once you identify the space that you'd like to utilize, that you check with your facilities management first. So your facilities management will be able to determine if that room is available, or maybe if they have different plans for that room that you weren't aware of. So it's definitely good to check in with them and make sure. And then also they might be able to point you in another direction if that space isn't available. They might know of another area that you could use instead of that. At Children's, we also have a network of wellness champions that we utilize to support and advocate our Be Well program on site. And so you might also want to ask for some support from your wellness champions if one of them is in the specific unit or department that you're working on putting the resiliency room in. They're going to be a big influence for you on the employee population as well. So you can definitely utilize your wellness champions for some support. Next, we already had talked a little bit about connecting with management, but you'll want to make sure that that point of contact is in a management type position so that you can get on the agenda for their next department meeting or staff meeting, so that you can present your ideas to them and really include a lot of the research and data behind it, and maybe share some testimonials. And really this comes into knowing that employee population again, and knowing who your audience is when you're describing what the room's benefits are. And then also providing that information for budgeting and the room setup, as well as the list of the kit items. Next slide, please. So currently at Children's Minnesota, we have 5 resiliency rooms throughout the organization. They have multiple different locations at Children's, and so we have a few in our St. Paul Hospital campus, a few in our Minneapolis campus, and one over in our business campus. And so since the turn of events here with the pandemic, with COVID-19, the Hospital Incident Command Center has been working in collaboration with multiple different areas of the hospital that are providing health and well-being resources for employees. And so they have been able to expand on the resiliency room idea to offer some larger spaces called employee resource support centers. And so these are dedicated conference rooms similar to a resiliency room that are able to accommodate more employees who are needing some support for mental and emotional health and well-being during the pandemic and working on the front lines. And so the image here shows one of the spaces. It was set up in what they call a star studio. It's a studio that's not being used, but currently they would have someone there who would be hosting shows and events for the kids in the hospital and playing games there and movies and such. And so with this not being utilized as highly anymore, they were able to kind of turn it into a larger expanded resiliency room area. And as you can see, they've incorporated some of the aesthetics we talked about with the environment of, they put in some soft lighting, they have some cushiony chairs, they have some different resources and flyers over on the other side of the wall that aren't included in this picture, but they've really taken a lot of the best practices that we utilize at HealthPartners and put that into their rooms at Children's. And so really these rooms are just providing a calm, a quiet space for people to kind of check in with themselves. Maybe it's just to relax for a few minutes or take a breather and recharge before a shift. But really these rooms have been a huge benefit for employees. And they are actually staffed 24/7 by Children's employees from their Child and Family Services Department. And so the staff there is able to keep a running track then of how many people are visiting the rooms and also make sure to keep that inventory of, what brochures are being taken and know when to replenish that. And so we've been able to coordinate with our spiritual care team, our Be Well program, our EAP program, employee health services, the bereavement coordinator, our peer-to-peer support team, and more throughout the children's organization to really provide all of these great resources for employees all in one place. And so through the employee resource support centers, there's 2 now located in each hospital, so one in St. Paul and one in Minneapolis. And the average utilization so far that they have tracked is about 100 employees per day. So about 100 visits from employees each day. And that is going on 24/7 so that the shift workers can also utilize the rooms too. And so we've found that they are being consistently used throughout every single shift and through every single hour, with the highest amount being the utilization between the hours of 1 p.m. and 2 p.m. So kind of right after that lunch hour. And so far to date, there's been 10,521 visits that the employees and staff have tallied. And so with those numbers, you can really see that it's a huge benefit for employees. It's really been a great success so far that we've had so many employees be able to utilize the rooms and get connected with the resources that we're providing so that we can really be fostering that culture of health and well-being throughout the organization during a really difficult time. And so I'll open it up for questions here as we have a few minutes here before Kerry jumps on.
Thank you.
Thank you, Kelly. That's fantastic. Cinca, I can't see the chat, but I just want to ask a question before, and then I'll open it up to the chat. So Kelly, this is fantastic. I mean, I think the last time we talked, there were 5,000 visits, so it is doubled essentially in this short period of time. I'm wondering, with COVID and the 6 feet apart and things, what has been done to kind of change the rooms to adapt for COVID a little bit more specifically?
Yeah, I know that our infection prevention control team at Children's has been incorporated into the rooms where the seating and the chairs have been spread out to be 6 feet apart. And then as far as, best practices of keeping the room clean and such, they are making sure that employees are continuously washing their hands and wearing PPE while they're still coming into the rooms and such. So they are being cautious of that as well. But yes, definitely can be a struggle, without proper supplies.
Sure. Thank you. Sanka, questions on the chat, or anybody want to unmute and ask a question?
So we do have 2 questions that have come through the chat, so I can read them now, unless somebody wants to ask a question, just via Zoom. Okay, so the first question is, how are you managing the rooms during COVID related to cleaning issues and spread management?
Yeah, so that would be part of the tasks that the Family Resource Support Center is working on. So when I was talking about how the rooms were staffed 24/7, they do have someone there throughout the entire day who is able to not only, keep tally of how many visits are coming in, but then also be able to use, wipes that are, they're wiping down different areas such as the seating and making sure that employees aren't touching like the same pen, for example. So it's only the staff who is making the tally of employees who are coming in, so they don't really have to touch anything. And then also on the tables where they have the brochures and different flyers and such, they're having someone hand that out to them, so it's not like they are all touching through everything. So definitely being cautious of that during COVID. And then also, like I said, they're continuing to wear masks throughout, as well as focusing on hand washing. So.
Thank you. The second question.
Great question.
The second question through the chat is, what types of resources have been most commonly utilized in the support centers?
Yeah, so I don't have any information on how many brochures or flyers and such have all been taken. However, we do partner with many different areas throughout the organization, such as the spiritual care team. Our bereavement coordinator has provided lots of information for grief and loss. I would say our EAP program that is specifically branded for children's, it's called Solutions to Thrive. That has probably been utilized, I would say almost the highest, just because they have so many different resources available through the EAP. So that would probably be one of the top ones. And then also Kerry, who's going to be speaking here right after me, can probably give some more information around the peer-to-peer support program, which I know has also been highly utilized as well. So I would say that those are probably some of the top ones.
Thank you. And Callie, this is Jody. One more question. So this had existed, I believe, prior to COVID, right, at least one of the locations. And so is the 10,000 most reflective of the COVID era, or does it include kind of pre-COVID? And have you seen an increase in use during COVID?
So pre-COVID, we had 5 smaller resiliency rooms throughout the whole organization. So those were rooms that were either converted from like a small closet area or a small office room. And those are all still available for employees. But, once COVID all started and everything started getting really difficult on the campuses, that's when the Hospital Incident Command Center really came in and said, hey, let's expand on this idea and create these larger expanded resiliency rooms for employees. And so while we still do have those 5 smaller rooms still up and running, this data that we're sharing is only from the 2 larger employee resource support centers, which are basically expanded resiliency rooms. So that's where the data is from. Yep.
So that's reflective of the COVID era, essentially.
Correct.
Yeah, that's amazing. I mean, and I think when we talked a while ago, I was just struck by the data then, which is double, but that, in terms of really proving the need and the consistent need over time. So the fact that you have only increased and doubled in this short time means that it's continuing to be used? Are you getting qualitative feedback from staff at all?
I have not personally received that, but I know that in some of the town halls there have been some comments that people are really appreciating the rooms. But we actually have, from last year, we have an ongoing study that we have started through one of our directors at Children's, and they really wanted to see more data on what are the benefits of these rooms and how are people utilizing the rooms. And so that was started, as I said, last year in one of our smaller original resiliency rooms. And so we still have an ongoing study with that happening that we'll be able to pull some more results from on in the future. And then we can kind of compare from that as well.
Fantastic. Any last questions for Callie? Well, thank you, Callie. Love the program. Love the data. I mean, it's really, talk about successful. It really is. And so I have your email up here, but I'm going to switch to Kerry's slides. For those who want to talk to Callie, reach out to me. I can connect you, and we hope to have you back in the future to hear how it's continuing to grow. So really exciting.
Thank you so much, everyone.
Thank you. Okay, I'm going to just switch over slides. And Kerry, I am going to turn it over to you.
Great. I think the only thing I'll add on to Callie's presentation, besides that you did a great job, Lisa, you had a question about what we were doing just to keep things clean and safe in this time of COVID. We are a facility that requires masking everywhere. And we also, all employees have to do a daily temperature and log that within the system. So if that's something of note to share. The other thing that is available in these rooms is a to-go bag, because they know that not everybody can come and stay. So we've got these cute little brown like gift bags that have some tangible things and of course some flyers as well, just directing people to some additional great resources. So pretty exciting. We hope to use that data to leverage us some more rooms when COVID is done. This is the big goal here now. So anyway, in my time with you guys here today, I've got a couple goals. I'm hoping that, well, I will talk about the importance of providing education or reminding your colleagues of what they already know. We'll talk a little bit about the importance of creating time for people to reflect, create a plan, and to trying new things on. And then lastly, the overall importance of creating a culture, your own mini Make It Okay campaign, where you encourage individuals to share their experiences, the good, the bad, and everything in between, and that it's safe to do that. You can advance the slide. So here's a little bit about me, so my title, I'm a clinical education specialist for critical care nurses, is really my focus, but my side hustle or my passion really lies in supporting individuals in their mental and emotional health needs. So Callie and I co-chair our Workplace Wellness and Wellbeing Committee, and I also co-lead our peer support program here at Children's Minnesota. And really what brings me to this work is about 10 years ago, I was working here in the PICU as a bedside nurse, and I was living on the ceiling, only I didn't know it. I was telling myself I was fine, but I really wasn't. I was irritable, I was exhausted, I was super serious about everything and anything I did, and tears flowed at really weird and awkward times in my life. So I told myself that there was just something wrong with me and I wasn't cut out to be a PICU nurse or an ECMO specialist, and I just needed to move on. So I started to plot my escape. Luckily, well, I'll just say that what I didn't realize was that I was having a normal reaction to a crazy amount of stress. And when I looked around, I didn't realize that other people were experiencing the same things. I just felt really alone because I wasn't in a place, or we didn't have a culture at Children's yet where it was safe to say these things out loud. So I felt like my best and only option was to leave. I'm happy to say I didn't leave. I'm going to celebrate my 20-year anniversary next month, which is exciting for me. And now that I have the opportunity to work on programs and systems that kind of provide this scaffolding around healthcare workers so that they can really continue to do the work that they trained so hard to do and really have a passion for. So I like to share this story, not because I think it's unique or special, but I think other people have really similar stories, and it's important to say them out loud. You can go to the next slide. I don't have any disclaimers or disclosures. We can go to the next slide. All right, so I believe, and this is my own Kerry Appleton personal belief, that we have as a society defined ourselves out of self-care. What do I mean by that? Think about how you currently define that word, self-care. It's a hot word, right? We hear it everywhere we go. People are talking about goat yoga and all kinds of exciting things they do for their self-care, but what do people actually do? So if you would have asked me 5 years ago what my definition of self-care was, I would have told you, well, it's when my husband gives me a gift card on my birthday to go get a massage. But sometimes he forgets, so sometimes it's every other year. So if that's really my definition, I am only getting or doing self-care once a year or every other year. That's not really that great. But when I sat and thought on that a little bit longer, I'm like, well, that's not really true. There are lots of other things I do every day that bring me joy, that make me happy, that bring me peace, that help settle me. Why don't I include those things in my definition? So it kind of began a challenge within myself. So what I like to encourage my students to do is think about this definition that they've created, and I challenge them to expand it, to take self-care off the pretty shelf that's high with the breakable things and bring it down to a level where it's attainable, not just once a day, but maybe several times a day. And it can be even as small as holding a warm mug, which I always have a warm mug with me because I'm always freezing in the hospital. And it could be filled with coffee or tea, or today I'm just drinking hot water because the feel of that warm mug on my cold fingers just feels really good. So now I include that in my own personal list of self-care. You can go ahead, Jody, and go to the next one. So like it or not, we are all going to continue to experience stress. And this was even true before COVID. Stress and stressors are going to keep coming at us throughout life. And we have little control over those stressors that bubble up. But our opportunity really is how we react or respond to these stressors. So I have a brilliant colleague, Suzanne Nelson, who works in our simulation center, and she has an analogy that I love to borrow. And she talks about all of us thinking about ourselves as a balloon. And as we march through life, we encounter critical incidents or stressful events. And each time we go through one of those, our balloon inflates a little bit more. And if we keep going forward and we keep inflating our balloon, what eventually happens to our balloon? It pops. I love this part in a classroom audience, because there's always sound effects, but you don't get that on a webinar. I miss that about a live classroom setting. Anyway, so some of the ideas that I'm going to talk about today are things to think about to really proactively or purposely take a little bit of air out of that balloon so you don't get to a point where you're going to pop. Next slide, please. So this is an image of a worksheet that I utilize here at Children's in a couple different ways. We have some standing classes that we do with onboarding of nurses here called the Support for Success series. I've also been doing a lot of individual workshops with groups because, funny enough, everyone's stressed out right now, which is crazy. And, unfortunately, this was a problem before we got to COVID, but it's just amplified now because we've really got the fire underneath us. So this worksheet was intended to be a proactive approach for individuals to really identify their reactions to stress. Like, what does stress look like on them? And to start thinking about what their self-care plan would be. because the idea here is I know there'll be a next time. So when there's a next time, instead of trying to think about what to do for yourself when you're in a really heightened state, you can go to your list or your menu that you've already created for yourself. Next slide. So as I was looking at this list of people that are on this call today, you guys know probably a lot about stress. And I'm super jealous about your future speakers, Dr. Wu and Dr. Scott. Jody, I'm gonna ask if you can let me listen because I've kind of idolized them a little bit. But I don't want to belabor this point, but as most of you guys know, as human beings, we tend to have 4 different reactions to stress. And for a lot of the people that I work with, nurses, they haven't really thought about it like this before and really haven't made the connection to what they're experiencing to the stress that they just had. Like, oh, that mental fog that you're having after a really long day or a hard shift, that's directly connected to the critical incident you had 4 hours ago with your patient. So we spend a good amount of time just talking about each of these different areas and what these things can be. And emphasizing the whole time that every one of these things is very normal. You're having a normal reaction to a really abnormal situation. Next slide. I should say that these 2 slides here, the reaction slide and the treatment slide, these are 2 slides that I use with my worksheet. So if I'm going to meet with a group, I talk a lot about reactions and treatment ideas first before we move on to the worksheet. So with treatment, you know, I work with healthcare professionals. They know lots of things, but they're still not always the great people or the greatest people on taking care of themselves or actually doing self-care. And probably most of us on this call are guilty of this. I'll admit that I still have to be really purposeful about it because it's way more natural for me to take care of other people than it is for me to take care of myself. So something that I've learned along my journey was this idea of when we experience a critical incident to think about the science, which I really love that because I'm not much of a touchy-feely kumbaya kind of person, or at least I used to think that. But I could lean on the science, and that's really helped bring along some of my other colleagues that also didn't want to be too touchy-feely. So what I share with them is when you have experienced a critical incident, it's really important for you to think about sweating it out, crying it out, or peeing it out. So it's a kitschy phrase, right? It sticks with people, but what's the science behind it? Everybody knows you're supposed to drink water. Why? Water's great for us for lots of reasons. But the reason why water is so important when we're really stressed out is it's going to help you actively excrete hormones you don't need anymore. That makes sense to nurses and doctors and respiratory therapists, people that are science-minded. They can get behind that. I can drink water and it will help me feel better. Same thing is true with crying. A lot of us have our safe places that we go and do this. Mine was the back hallway in my unit or my car on the way home. And this is a little bit of why it feels good afterwards. And then the same thing with sweating. I go through each of these images, just talking about you know, the importance of things to eat and things not to eat and how sleep resets us. And then this idea of having friends in our life, both outside of work and at work, because our work friends or our work family really understand the best exactly what we're walking through in this moment, which can be really helpful. Next slide, Jody. So the pause is really intentional, and of course proactive planning is preferred, but as we here are in the soup, we have to figure out a way to keep swimming. So I would encourage you to consider bringing an idea like this to a team meeting, because you know, you can offer suggestions to people all the time, but as a leader, making time for it, like actually carving out 10 or 15 minutes, that really shows an investment in them, that you really want them to do this and not the other 25 things that are on their to-do list. So that can be really helpful. Next slide. So here we are in the state of COVID. We're going to shift gears a little bit to talk about what we've been doing for teams here. And you can go to the next slide. Callie mentioned we have a peer support program, and we started at the end of 2018. And we are an interdisciplinary group of clinicians. We currently have 91 peer supporters, and we have about 7,000 employees. When people ask me what's the ideal number to have, I've heard 10% or 20% given. I think what we're trying to do now is we're trying to get 10% of every area, so every department or unit, and we have a long way to go in that right now. So currently we do have, the bulk of our providers are nurses. We do have some APRNs, some physicians, respiratory therapy, child life, and social workers on our team. And the idea was that, you know, sometimes you want to talk to somebody who does your exact same job. So you would feel way more comfortable talking. For me, I'd feel maybe more comfortable talking to another nurse. But there might be other times where you don't want to talk to somebody in your own profession. You'd rather sit down and talk with a pharmacist or talk with a physician. So we have those options. At Children's Minnesota, we provide an internal course that we actually purchased our content from Dr. Sue Scott, who you'll be hearing from in next month. She teaches a great course. What we did here is we sent down 7 people down to Missouri to sit through her course and bring that work back to Children's, so that we could provide an internal train the trainer model here that's been successful. And then upon completion of our course, we really ask our peer supporters to provide 4 things. We ask for people to willingly provide peer support in the areas where they work. We ask people to educate people on what peer support is, because what we learned early on is you can train people to do lots of things, but if you don't educate the end user, no one's going to use the product. So that's been a really important and ongoing effort. The third thing is to complete our encounter forms. We need data. I'm sure a lot of you guys can relate to that, as data equates to funding. So we have funding right now, but funding for 2021 is going to be probably a little bit harder to come by. So we're hoping to use the numbers that we have to show our worth, that we are doing something here, we're making a difference, and that we should be they should continue to invest in us. And then the last thing we ask is that peer supporters attend a quarterly peer support meeting. It's 1 hour every quarter. You can attend in person or via WebEx. We offer contact hours, food if you come in person, because food always gets healthcare workers. And you know, we debrief peer support sessions that people have gone to without sharing names. We talk about things that have gone well, the things that didn't go as well, and take suggestions from other people as well. Next slide. During COVID, our peer support team really stepped up right in April, end of March going into April, as things were really starting to ramp up in Minnesota. So we provided call-in support. We did group debriefings via telephone conference call. We ran 42 sessions in the month of April, and then in May, we shifted to do private groups. So we had units that were closing completely, and we had management that was looking for ways to bring their team back together to support them through being on a furlough and not knowing when they were going to be able to come back. So that ended up being a really good offering as well. Next slide. This is a cool little poster we created that is in the Employee Resource Support Center. It's in a cute little postcard size, travel to go, but it's also in a larger poster size throughout our organization. And it was created to really ask people to pause for a moment and think or do a body scan, head to toe. How are you doing right now? And how are the people around you? Just hoping to ground people a little bit before they were heading out the door. Next slide. I'm going to skip this because Callie covered it beautifully. And I think that's what I have for you guys today, but I'm more than happy to answer any questions that might be on your mind.
Fantastic, Kerry. That was wonderful. Thank you. I'm going to turn to the chat. I have a few questions, but want to see, Senka, are any questions in the chat, or anybody want to unmute and ask a question?
No additional questions in the chat.
Okay. Kerry, how are you tracking kind of how you're going to use the peer support team? So what's the kind of monthly, how did you evolve from April to May? And what are the kind of goals moving forward in the next few months in terms of private, or what's the thinking?
Right now, it's been by request. So initially how it started, our CMO, Dr. Emily Chapman, was on a listserv, heard some good ideas about something like this and wondered if we could create it here at Children's Minnesota. So when your CMO asks you to do something, you figure out how to do it, which I was really glad that she looked to the peer support team to do it. And really everybody wanted to help. So it was not a problem at all to create these calls. And we just took volunteers, and I just created a sign up genius for people to sign up for their times. It was at 8 in the morning and 8 p.m. And we had a script for the call. So they all began the same way and kind of had the same formula. But then the facilitator could choose what type of self-care activity they wanted to do at the end. So whenever I facilitated, I would end with a guided imagery of bringing people into a forest. And then there was different poetry that was shared and other guided meditation experiences as well. Going forward, I think we're just keeping our ears out to what people need. You know, there's a lot of, it's going back to business as usual in some respects. So a lot of our usual stressors are here, and the stressors that we weren't exactly doing so great with. You know, there's still a lot of opportunity. We're far from perfect yet. So we need, you know, you have to leverage a pandemic for what it's worth, right? And so probably the best thing for us that's come out of COVID is the awareness of the peer support program. We've gotten to be on a couple of our town hall calls to advertise the program a little bit more broadly. So we are getting a lot of airtime right now, which I think is helping us. Our classes are filling up, which is a little bit of a problem because we can't have, we're still doing in-person classes, but we're limited to 10 people per room unless we can get 4 instructors, and then we'll run a double session in 2 separate rooms, which we have done. We did that last month.
So there's a lot of interest, and that's great.
Huge interest. Yeah, we have a class on July 20th and another one on August 3rd. So a lot of people are stepping forward right now wanting to do this.
Fantastic. And I put back on the screen, because I know when we had talked a month back, you talked about this going home checklist, and I thought it was a really great idea. So for those on the call, I put it back up on the screen because I think that's a really interesting way to, you know, a small thing to do to really help staff think about going home and how to just shift gears. And I wonder if it can be combined with a little bit of what you said earlier with the pause of really making space for them to do that, right? So giving them the time at the end of a shift to do that, right? And giving them that pause and saying, we believe the pause is important. Everybody think about this. Because I do agree that that's important, right? How do you make it easier for them to do these things and build in the time?
Yeah. What I've really been impressed with, especially in the month of March and into April, I had team leaders from our finance department, from our IT department, reaching out for me to come and talk with their teams about stress, and a lot about what we talked about today, which I thought was really great because, you know, part of our longer term goals with our peer program is we want to have peer supporters for our business campus. That yes, we started out as a clinician focus, but our team here at Children's is made up of more than just doctors and nurses. And it's really important that we have peers in every single space of our organization.
Well, this is fantastic. Thank you so much. Thank you for the plug for our future speakers. This was unplanned. Kerry did not know. I just talked about Scott yesterday, so I didn't even tell her. You know, Dr. Wu and Dr. Scott are really leaders in the field of physician, clinician well-being, education, second victim kind of thinking, even pre-COVID, that
Oh,
now they're continuing on. So I thank you for that. And I really encourage everybody to attend those. We want to show them that the Midwest cares about these things and really kind of let them present to kind of our part of the country.
Jody, this is Senka. A question came through the chat. Do we have time to ask?
Yep.
one last
Yep.
question?
One question, that'd be great.
Sure. So the question is, can you repeat what training your peer supporters get?
yeah. We provide it's about a 4.5-hour class. That's really focused on psychological safety is a lot of it. And, you know, fine-tuning those listening skills, really talking about that you don't need to be in the detail of what the event is, because we are not counselors. We are not psychologists, psychiatrists, we're none of those things. We are simply a peer that we're able to meet somebody where they're at in that moment and bridge them to additional things. A lot of times people just need to be heard. They need to be validated, and that's enough. But sometimes people need the next step, and that's what we can help with as well. So generally we'll meet with somebody either in person or over the phone for an initial consult, and then we'll make plans to follow up with them either over the phone, text, email, in person, to see if they need anything more, just to kind of let a little bit of time sit and settle and see how they're doing, usually 24 hours after.
Fantastic. Oh, go ahead, Senka.
I see it. Where did the curriculum come from? Yes. So we purchased the bulk of our curriculum from Sue Scott, who you'll be hearing from in August, the For You Matter program. And then Children's National also has their curriculum available for purchase as well. We had a one-time donation. So back in 2018, we thought it would be smarter to just purchase content and modify it to fit us, because our steering committee is made up of people that we're all really busy with other jobs, and this is just an additional work. It's not just, but this is a work group that we do in addition to our full-time roles. So that was helpful in getting us to launch as quickly as we were able to.
Fantastic. Thank you. So great, Kerry. So appreciate. Please come on in the future ones. And
I will.
Dr. Wu, this is open to everybody, and everybody pass along the word. Just a quick reminder that you can go to our website. You can go to just ICSI.org, and then you'll see the information about the upcoming calls. And our mental health playbook is there, which is really a compilation of a lot of the work that you all are doing. So we'd love your comments on it. And then a reminder that our next one is Tuesday, July 14th with Dr. Albert Wu, Johns Hopkins. So we'll send reminders. Sorry to switch the day, but that's when he was available, and we wanted to make sure he could come and talk to you all. With that, happy July 4th weekend. Welcome to July. I hope there's no surprises behind the door, and that we have a quiet month that's as uneventful as possible. Thanks, everybody.